Today is February 4, 2022, and it's World Cancer Day. We are presented with yet another opportunity to broaden the conversation on cancer awareness. So for us, early detection of cancer-related cases are concerned. And all of this is very critical in helping to reduce cancer-related deaths in Ghana and across the world. And one foundation that's championing this cause is the City Cancer Challenge Foundation. They're doing remarkably well so far as cancer awareness is concerned. And we've been joined via Zoom by the original director. She's in the person of Mrs. Sophie Busman Kemjo. Good to have you join us on Metro News.
Thank you. Glad to be here.
Right, so let me pick your first thought on February 4, 2022 as World Cancer Day. In time past, would you say that we've done enough, we've taken due advantage of a day like this to promote cancer awareness?
First of all, we are very proud to be active in Ghana and Kumasi. So City Cancer Challenge, it's a multisectoral initiative dedicated to support cities around the world as they work to improve access to equitable quality cancer care. And in Ghana, we have been achieving a lot since the organization, the city joined us. And we can proudly say there are a lot of progress that have been made recently. And the city of Kumasi and Ghana at large are really champions in terms of fighting against cancer.
Right. Right. So we do know that Kumasi was the first African city to be selected to join the City Cancer Challenge. At the beginning of the year 2018, what have been the major improvement in your view?
What we actually introduced in the city of Kumasi when we started to roll out the initiative was to establish the City Executive Committee. That is a body of governance, body of the initiative that united actors from across sectors, from government, Ministry of Health, from the private sector, main hospital, the civil society, and it has been a tremendous, tool and the way of actually breaking silos within, among communities. And thanks to that, a lot has been achieved in terms of defining the needs of the city by involving all of these actors and also putting in place and implementing projects that are meant to address the initiative, the needs that were identified. So we're very proud of that, and it's counting. We also have, thanks to this those progress, the support from the German Development Agency that is really supporting quality, timely access to diagnostics, cancer diagnostics. And thanks to that, there is a lot. So Kumasi is doing great works, and we're very proud to be supporting the city.
Right. Oh, what would you say is acting as that catalyst for the improvement you've seen in Kumasi? If you can hear me, I was asking, what would you say is contributing to the great success stories you're seeing in Kumasi?
The great success story is the people. Right. So our methodology is really built about developing capacity, improving, and working with people for people. And by having all the key actors around the table who were really willing to develop and advance cancer care in the city, they were able to do a lot, and also willing to take their time to improve, their profile. And one of the examples is also fellowship that have taken place by different groups going, for example, to Mayo Clinic in the USA, where they took trainings, taking all the time that they had to come back and contribute the knowledge into the context.
I see. Now the World Health Organization, right? The World Health Organization has declared cancer as a growing global health threat. Now, beyond your support and what you're doing as a foundation, what measures do you think that countries can employ going forward so far as the fight against cancer is concerned?
Cancer is just also something that is growing, as we know, around the world. And in the case of African continent, it's also linked to people living longer, to also access. So we need to make sure the local government needs to make sure that we're working on strengthening system. and by also approaching it from the city level, we have seen that city experiences can be scaled up at the country level. And why are we doing this is because cancer is a complex disease. There is data that is needed in terms of informing policies development. There is also the massive needs in terms of resource mobilization. So by not working alone. So if we take all of this and that is happening at the city level, it's easier to scale and understand how you can strengthen the system by taking it from the city approach. So the experience of the city is tremendous in terms of actually informing the country policy and how cancer is being tackled at the country level.
Right. So we do know that the Cancer City Challenge Foundation is spearheading the launch of the Global Coalition for Cancer Diagnosis. Why is this launch crucial? Tell us more about this launch.
Thank you. So we have seen a lot of advancing in digital technology, and it's very important to actually leapfrog on the effort. So the call come in a time where we want really to have all the actors coming back to the multisectoral approach that I was talking about earlier. It's really about bringing all actors together to find solution and also the resources that are needed to implement those solutions. And having the local voice is very important. So it's a coalition that is global, but it's also, as I was saying, it's all about people always. So going back to the people who are actually working together and showing to our actors from the private sector, from government, all of the actors to just come together as one person to ensure that we can reach quality and timely cancer diagnosis in Kumasi, because this is what at the cornerstone of the fight against cancer.
Right. Sophie, thanks so much for talking to us on Military News. It's always a pleasure talking to you. So I have an engaging Sophie Busman Kemjo. She is the Regional Director for the Africa and Europe City Cancer Challenge Foundation. Thanks so much for joining us.
Thank you for having us. Thank you.